It is just a huge honor for me to be in Scotland, podcast interviewing Dr. Salwa Ibrahim.
Yeah.
Did I say that right?
Yeah, you did.
And you are just you are the rarest unicorn I've ever podcast interviewed. You were born in Egypt, got out of dental school at age 20?
Yeah.
You started dental school at 15?
Yes.
Huh, you must be smarter than me times 12. I barely got out at 24. And then you practiced in Saudi Arabia.
Yeah.
And then Dubai.
And then Egypt, Saudi Arabia, Dubai, and then UK.
And you practice now in UK?
No, actually, I finished my PhD in Pediatric Dentistry, and then I'm moving back to Dubai, hopefully.
Well, so you were born in Egypt,
Yeah.
practiced in Saudi,
Yeah.
Dubai, UK, but you want to go back to Dubai.
Yeah.
And I've been to Dubai. So some people call it the Las Vegas of the Middle East.
It is, actually.
Is that why you want to practice there?
Well, Dubai is very much like London. It's a very multicultural country. The thing that I really liked about London being has a very diverse population. So I got to see lots of patients from all over the world. I got Turkish patients, Irish patients.
I'm
Scots,
sorry.
British.
I'm sorry to hear that. Were they drunk when they came in the office?
No.
Really?
No, luckily not.
So they weren't real Irish.
No.
They were just.
But so many people from different backgrounds and different eating habits, different dental habits. So you really get the experience of not seeing just one category of people. Dubai is exactly the same. It's got people from all over, and you get that experience. You get to see different things and at different times, and it's just very interesting.
And I think the number one way to get smarter quicker is to get out of your own country.
Exactly.
And you're born and raised in a country, and they hand you all these beliefs, and then you go to like Singapore, and there's no water fluoridation. No, there is water fluoridation, but no insurance.
Exactly.
And you go to Tokyo, there is not water fluoridation, but they have insurance. I mean, you go around the world and you start seeing all these things. And I think the funniest multicultural experience I ever had is, for some reason, when I grew up, they used to always tell us that India, they were vegetarians, they were the healthiest eating people on the planet. And then you go there, they eat more snacks and cookies than any people I've ever met in my life. You know what I mean? I mean, you walk into a dentist's house in India, and his grandmother will bring out a tray of cookies instantly. You know, they're just and they put sugar, you know, in their tea and all that stuff. So what have you observed multiculturally about what's causing pediatric decay?
I think it's all about the knowledge, and especially parents. So awareness. It's really all about awareness. I think most parents are very confused about what's right for their children to eat and what's not. They think, so for example, for nursing parents, they would think that it's okay to leave the bottle for the baby. It's fine because they're getting healthy that way, they're getting bigger, milk is good for them. But they don't really realize that if you leave the bottle there, it's going to cause all these caries in their children. And then they get to the dentist and they're very confused. They're like, what did I do wrong? They're not even old enough to eat any sweets or, you know, or any sugar or anything like that. And you know, and you see their face extremely surprised and shocked when they say, well, it's the milk. And I think if we just try and focus on more awareness and just spread the word, and I think it will be much easier for everyone, and it will be, you know, you're gonna get out there and people will feel, oh, well, yeah, well, I didn't really know that. I didn't really know that apple juice can be bad for my child, or, you know, orange juice can be very acidic to certain children. And they'll stop feeling extremely guilty when they come to the dentist, and then, you know, it just makes it easier for both parts, the dentist and the patient as well.
And I think this is I think one of the worst things about the tradition of healthcare is we don't advertise. I mean,
exactly.
when they're selling cars and telephones and clothes and shoes and makeup, they're all over the TV, billboards and radios. And then physicians and dentists don't believe in advertising, and then the baby shows up with what?
I think it goes on the border of ethical and moral. So they're like, if you advertise to yourself too much, then are you really a good dentist? Do you really need that much advertisement? And if you don't at all, I mean, I've never heard about you before, so who you are you a good dentist? So it just goes on that borderline that you don't really know where is the right the right level of advertisement, and do you just depend on the spread of the word? I mean, a friend of a friend saying that this is a really great dentist, let's go there, or do you actually need to put yourself on billboards?
Well, you're talking about the individual.
Yeah.
I'm talking about the profession.
Yeah,
I think it's immoral and unethical for Coca-Cola and cookies and crackers and Keeblers and elves and trees making biscuits to be on TV all day long, and then the dentist and the pediatric dentist as a profession are not there showing a baby with cavities. That's immoral.
Yes, I totally agree. Agree.
And what's...
Sorry, I'm
Oh,
sorry.
no. I talk too much. You go. In fact, I should put electrical tape over my mouth.
I actually attended a masterclass a year ago in Thailand, and I got to see dentists from all over the world. So I got to speak to dentists from Australia, from Thailand, from India, from America, and from the UK, of course, from France, from Italy, and it was a pediatric masterclass, so we were all pediatric dentists. And the thing that I've noticed the most, and the thing that we've all I mean, everyone does things differently. The basics are the same, but we do things a little bit differently in each and every country. And I think the thing that we all had in common was not knowing how to deal with the problem. So what is the problem exactly? Awareness. And also how to deal with children themselves. So a lot of people had this epidemic of not knowing behavior control to children. Getting this child who's really anxious, who really hates the dentist, and they don't know what to do. So they'll either refer him to a general anesthetic and just take all his teeth out, or they'll just do nothing. And they'll just wait until he get his permanent dentition on, and that's it. And I think this is two of the most major problems out there, is just behavior management and awareness for parents. I think this is two of the major problems for pediatric dentists.
And I think those are the more important than the things we think, like fluoride in the toothpaste, fluoridated water, or having health insurance subsidize fillings, root canals, and crowns. And I think it's very interesting listening to Mike Gow yesterday. Is that
brilliant guy?
What's that?
He's a brilliant guy.
He's a genius. And I think what the thing that I walked away with from Mike Gow the most was that when we see children in America or even adult that has anxiety, we just mow it down by just knock them out, put them to sleep.
Exactly.
We don't, and then when they wake up, they still have the anxiety. We never treated the anxiety. We treated a tooth, we treated dental health, but we didn't treat mental health.
Exactly.
And if they have anxiety, why does a dentist want to dive into a tooth? You should try to enter their mind and treat the anxiety, treat the mental health. I mean, I'd rather lose all my teeth and keep my brain than keep my teeth and lose my brain. Even though my boys said I lost my brain years ago. They said they can't even find it. They've been looking for it for their whole life. So back to that pediatric convention, did they think fluoridated water was a significant factor in reducing pediatric decay? Or did they think not, and it was more behavior and awareness?
I don't think they really didn't talk much about it, and I don't think anyone is. I mean, except in countries like Somalia and Sudan, and when it's a real problem. I saw a lot of patients who had fluorosis because they were born in these countries, and and they come to, they immigrate to UK, USA, or any Arab country, and they just go to the dentist and we take care of them, and it's not really a big issue anymore. And I haven't seen any significant numbers, or I haven't seen any dentists treating it as a significant problems. I think it's all about the caries at the moment. It's all about how high caries risk children are right now, and the amount of sweets, the amount of chocolates and advertising and all that. This is a really major problem, and it's also about the parents not being aware that what they're letting their children eat is a problem, and how they're letting eat it is a problem as well. And it's all about awareness, really.
I spent a lot of time in Phoenix in '89. I spent like all my free time for a year trying to getting fluoride in the water in Phoenix, and then it expired 20 years later, and then I spent another year with all my time trying to get in there again. And I'm kind of losing heart in water fluoridation for two reasons. Number one, a quarter of the Americans are completely against the government doing anything, let alone pouring something in their water. Yeah. And I get that. I mean, I get that. I like the American government less than anybody I know in the United States. I mean, I can't stand. I mean, well, the government in the United States has only had an 11% approval rating for 2 decades. Mm-hmm. Imagine if only 11% of your patients approved of you.
Yeah.
You'd be bankrupt. Yeah. And so the United States government, they should be fired. So I get it. But the reason I'm losing faith in it is because when I go to great civilizations like Tokyo with no fluoridated water, they've brought down their pediatric decay rate through education, awareness, getting information on it. And information is more important than naturally fluoridating the water.
Exactly, especially in schools. Especially in Saudi Arabia, we do all the time that kind of thing. We do conferences for parents at hospitals, for example. We invite all parents, all patients to come and just sit in a big conference room, and a dentist or a dental nurse will talk to them about dental habits for their children. Same schools, a dentist or a dental nurse would go around local schools and just kind of get together with the children and just explain brushing techniques, and you should eat that, you shouldn't eat that. And it really is all about awareness. It really is.
So let's back up even further, because we already jumped into the conversation of treating a disease. Mm-hmm. But that baby was not born with that disease. I mean, that baby was not born with Streptococcus mutans to ever get a cavity, P. gingivalis to ever get gum disease, HPV to ever get oral pharyngeal cancer, herpes simplex 1, cold sores, canker sores. Do you think in your lifetime, I'm 53, how old are you?
28.
Okay, 28. So you're definitely the next generation. Do you think that you will live long enough to see a planet that becomes aware that don't kiss that baby, don't get these germs in mom's and dad's and grandma's mouth? Because you have a newborn baby and you hand it to your grandmother, she kisses it right on the mouth, and she's got gum disease, she's wearing an upper denture, a lower partial, she's got 6mm pockets, and she's kissing that baby right on the mouth. Do you kissing a baby, I mean, there's nothing more natural than kissing a baby. Do you think we'll ever get a society, do you ever think we'll get a generation of children that didn't pick up all the germs from its parents' mouth?
I think that the way that you approach it is not by saying, well, you can't kiss your baby. I think the way you approach it is kind of in an indirect manner. So I think, for example, pediatric dentists all over, you can't do something on your own. You have to work as a team. So if pediatric dentists got together, solves the immediate problem, which is children being anxious about dentists, for example, and that could be solved by getting more educated about behavior management, getting more educated about the best way to handle any situation with a child, and then the fear or the anxiety kind of wears off from the children and the parents themselves, and they're like, well, Yeah, okay, that isn't I think that we will be panicked about in the future, and then they'll teach their children to be a dentist is not the devil anymore. And then the next step would be when such a normal professional, he's not someone that you're fearful of, will just tell if you don't drink at night, that will be a good thing. And also, if you want to kiss your child, just kiss him on the cheek. That's better for him. And then the parents will kind of accept it more, if you know what I mean. When you're fearful from a person or a dental professional or anything like that, you kind of block a lot of things out from your mind. And it's one of the main reasons why dental advice doesn't really go through or doesn't really reach them 100%. They kind of just, so if my tooth hurts me, I'll just take ibuprofen, right? And then, but you have to do this and this and this, and you have to brush and blah, and this just goes all the way out the window, and they just focus on, okay, when it hurts, ibuprofen. But when it's someone that you're relaxed with, and you completely trust, and they say, well, you have to do this and this and this and that, it kind of all sinks in. Do you know what I mean? Mm-hmm. And you kind of trust them, and I trust that person. He told me I shouldn't be kissing my child on the mouth, just on the cheek. And I think, this is what I'm gonna do. And it's a gradual process. It will take time.
Some cultures kiss on the mouth a lot less. Like, we were just in Paris, and they always fake kiss to the left, fake kiss to the right. Whereas in America, your grandma just plants one right on your mouth. I've always wondered if there's less disease transmission amongst the French than in London. Than in Paris than in London. I wonder if there's any data to support that.
No, not really. There isn't strong evidence to support any high caries risk in any country, really. There has been established in the UK especially, and in Saudi Arabia there's very high caries risk. And it's also, again, because of the awareness. I think I've read a report a couple of months ago about how the UK has the highest percentage of children being transferred into general aesthetic to get their teeth taken out, just because
in the whole world.
Not in the whole world. I think it's in Europe. I'm not.
Okay, in Europe. The UK, where we're at now, has the highest percent of children being in.
I think I read the report.
The number one reason a child is put under sedation in a hospital is for dental disease.
For dental disease, yeah.
And sedation is very dangerous.
It is, especially general aesthetic.
But you would think London, this was a great civilization 500 years ago, 1,000 years ago. How could the UK be the fifth richest nation on earth and have this issue? You would think that is something you would see in a third world, very poor country. How could that be in the fifth richest country on earth?
I have no idea. The only justification or that I ever read, in reports and in studies was that it all goes down into brushing. People are not brushing enough.
I think the answer is blamed on the dental societies. They sit there and they watch a soccer game sponsored by Coke and Pepsi and crackers and Cheez-Its and chips, and then those arrogant doctors...
And sports drinks as well.
And sports drinks. And those arrogant doctors sit there and say they don't believe in advertising. Mm-hmm. And then when you go to those dental societies in America, like the American Dental Association has, a $200 million budget. They have 400 employees. And you say, why don't you spend 10% of that money running ads during Super Bowls and soccer games and Children's Ill, competing against Coke and Pepsi and crackers and cheese, and they say we don't believe in that. It's like, do you believe in gravity? They're watching television. They're watching their device, whether it's an iPhone, an iPad, or a television, 4 hours a day, and we're not there. And then and who is there? Everyone selling sugar. Exactly. And then at nighttime when you're like, I need to just go to bed, and the TV's like, McDonald's is still open. Come by for a cheeseburger. You're having a Big Mac attack. But there's no ad saying, don't forget to brush and floss before you go to bed. You know, don't forget to take a glass of water and swish out all that sugar and brush and floss and go to bed. No doctor's there. But there's the old McDonald's telling you, hey, we're still open. We got a drive-through. You don't even have to get out of your car. Just drive through. You could be in your pajamas, drive by and get a 64-ounce Coke and drink that right before you go to bed. There's obesity, there's diabetes, there's pediatric decay, and then there's the most highly educated people in society, the doctors, and who make more money than their patients, and it's a complete no-show in marketing and advertising.
Yeah, it's a global problem.
Yeah,
Really
and you know, another thing that's funny is that, well, it's not funny, it's just ironic, but if you go from New Delhi and drive all the way to Kathmandu, if you flew over that in an airplane at 100 kilometers an hour, I mean, all you see is nonstop billboards for Coke the whole way. I mean, you would almost think, an alien would almost think the country was invaded by Coca-Cola billboards. When you walk around Kathmandu, when you see a billboard for Coke, and turn around, you can see the one behind you. You never lose sight of a billboard for Coke. Yet you'll never see one billboard. Brush, floss, don't go to bed with the bottle, be careful of sugar, you know. So we're just getting out advertised.
Yeah.
And it's 1,000 to 1.
And the toothpaste companies, what my own feeling is that what they really advertise about is you know, they're gonna get whiter teeth. That's it. I mean, this is all when I see any toothpaste advertisement, it's all about you're gonna get whiter teeth in 2 weeks. You're gonna be up 5 shades, and I'm like, okay, well, this is not the only job of a toothpaste. You know?
In America, you tell your patient, okay, ma'am, you have 10 cavities and gum disease. And she says, okay, but can I whiten my teeth?
Yeah. Exactly.
So I want to ask you the most controversial question in all of pediatric dentistry.
Okay.
And that is, can mom come back with the chair? It's highly understandable that the baby's the most important thing to mom. Trust in society. I don't want to hand my baby to a stranger and have her walk around the corner. I want to see my baby.
That's correct.
And some pediatric dentists say never. Some say always. What are your thoughts?
I think it depends on the age of the child. So I wouldn't be comfortable with the parents leaving the room if the child is less than 5 years old.
So you want the mom?
If the child is less than 5 years old, then yes. I think there's still this maternal attachment, and the child, especially if he's 3, was gonna feel that he's gonna freak out basically if mom leaves, and it will just makes everyone's job a bit harder. If he's a bit older, it will really depend on the child. So if the child is comfortable for mom and dad being around, I would completely let them sit there and just watch what's happening, given that they wouldn't really interfere. So I would tell them words like, don't be afraid, it's not going to be painful, the injection is so easy. I'm going to say, well, you can't really say anything, you can't say any of that, because you just completely interfere in my treatment. So you can just sit there and watch, but you can't really say anything. Some parents are very disruptive. So they would, their children was there. They just got them, picked them out from school, and they have a million things to do, and they're like, just get on with it, just get the filling, and and they got this really negative attitude. And at these kind of times, I would ask the parent, well, would you mind just sitting in the waiting area, and we'll be done in 20 minutes or so. And if it's okay with the child and the parent, they would be happy to, and it will just go smoothly.
I always like to study the difference between maternal instincts from moms. Like female cheetahs never eat their babies, but male cheetahs do. Female polar bears never eat their babies, but male polar bears do. I was wondering if 100 children are brought into a pediatric dentist, what % are brought in by mom versus dad versus both?
I think 50% will be brought up by mom. I think, and then the other 50 will be really a 50-50 again. So, 50, 25, 25.
What would the
I think
25, 25,
the
50 mom?
50 mom, 25 mom and dad, and 25 dads. Not a lot of dads would come with the child. I think it's mostly mom.
So
has
what
to be
percent
there.
would just be dad bringing the child?
It would be about 25% or 20% even. Not a lot.
I've almost eaten my 4 boys at least twice. One time I was out of milk, and the other time I was out of bread. You guys are just lucky to be here. And so what? Why do you think, back to the maternal instincts? It's, I have been doing this 29 years. If I ask 100 men, I tell them the 9 specialties: endo, pedo, oral surgery. I tell them all the specialties. Which one do you hate the most? The men will always say pediatric dentistry.
Yes.
Why do you think that is? I mean, and myself personally, the best thing about dentistry, the very best thing about dentistry, is that there's pediatric dentists like you. Because I'd rather do a root canal on a man. I'd rather pull 4 wisdom teeth. I'd rather do, if I had to do your, no disrespect,
Yeah.
but if I had to do your job, I quit. Why do you think that is? Do you think that's a male female thing, or do you think I just got off to a wrong start on pediatric dentistry, or culture, or what do you think that is?
I think, on my personal opinion, it's about tolerance and patience. So if you get this really, really anxious child and you don't have the patience and the tolerance to, I understand that you're not being a brat. I understand that the fear of your parents is projecting onto you, because they're like, some parents would say, if you don't behave, I'm going to take you to the dentist, going to pull all your teeth out. And
Oh my God, really?
Yeah, yes. And
Oh my
that's the
God,
most horrible
I've not
thing.
heard that one before.
Yeah, they do, and they already have gotten to your chair having this idea that you're gonna pull all your teeth out, you're gonna get this really huge injection, and this is just a punishment. Being in that chair is a punishment, and you just have to have the patience to try and change that in the child, to try and well, you know what, we're not going to do anything that you don't want us to do. We're just going to, see what the problem is and fix it, and that's it. If you don't want to do anything, we're not going to do that. And I get these lots of surprised looks from the children. It's like, what, really? I have a choice? I'm like, yes, you completely do. And it's not your mom's choice, it's not dad's choice, it's not my choice, it's your choice. So if you want me to do something to help you, I would. If you don't, then we're not going to do anything today. And that's it. And you kind of, gain the trust to establish rapport. And, the next time they come, they're like, well, I think I'm going to do something today. If it's, if it's up to me, I think that tooth has been bothering me. I think I'm going to do something about it today. I'm like, oh, well, okay, that's improvement. And I also talk to the parent. So I'm like, there are certain things they shouldn't say to your child. You shouldn't, you shouldn't give too much positive influence. Like, if you go to the I'm gonna get you that toy that you always wanted. I don't want it to be linked to that. I don't want it to be something that an errand that you have to do. It should be something that you tell your child he has to be excited about. I remember that one patient. She was 7 years old, and she always been anxious about any kind of dental treatment. She never let any dentist touch her. And when she came to me and I sat with her and we've talked and we've chatted, and then, three appointments into her treatment, and her mom, she comes up to me and she says, well, I've never seen my child excited about going to a dentist before. You've completely changed her life. And I was really happy. I felt really privileged. Yeah, it was so amazing that I made this impact. I imagine that child grown up and I'm just completely changed. And if that child gets her own children, they wouldn't be anxious children. It will be the next generation who's completely comfortable with going to the dentist and aware about how important their teeth are, their dental health is, and it makes you feel that you're making an actual change. And it's very satisfying.
Back to I also when I got out of school, OBGYNs, gynecologists, they were all male. Now they're all female. I see, and I'm predicting the same thing happening to pediatric dentists. When I'm in America and I look at those pediatric programs, America only graduates one pediatric dentist for every million people per year. So there's 330 million Americans, and they graduate 325 pediatric dentists. But like for this last class, I still haven't found a male yet. And when I talk to these young pediatric dentist graduates, most of them will say, yeah, in our program there were 6 of us and we were all women. Do you think pediatric dentistry is going to go the way of OBGYN and gynecology and turn into pretty much an all-female profession?
I think that if we, in universities, especially undergrad years, if we put behavior management as the main subject to study, so most people would say, well, you know what, you're either good at, treating children or you're not. It's just a talent that you have to have. And I don't agree with that. It can be taught and can be learned how to deal with children, how to deal with anxious patients, how certain techniques to be learned. I know when I was attending with Dr. Mike Gow, he has got these lots of experience, lots of techniques that can be taught. If that kind of thing was taught in an undergrad level, I think male dentists wouldn't be so freaked out about, treating children. I think, well, you know what, I've got this anxious child. I think, I know how to approach him now. I think people, I've been taught how to deal with that kind of situation, so I think I'm going to go for it and do it. But if I have no idea what I'm doing, I just know that there's caries, there's a filling that has to be made, how I'm going to get to that point, I have no idea, then, well, you know what, no, I'd rather be treating an adult and, open your mouth.
But I already know what the dean of the university is going to say. He's going to say, I'm sorry, we're too busy teaching them geometry and trig and physics and calculus.
I don't know why we're doing it.
I know. It's like I literally look back at my college years and say, okay, I went to 9 years of college. I could have gotten rid of 80% of those classes and not changed my career 1%. I mean, I still don't know what I'm doing with, my French history course, you know what I mean? Or the difference in geometry and trig. I mean,
botany. I have no idea what I've done with all the plants that I've...
Yeah, I mean, it's like, and what it is, it's job preservation. You go into the university, they're not going to say, well, let's cut the math department in half, let's cut the biology department in half, and let's bring in psychology and behavioral techniques. And I just wish kids got out of high school. They've wasted so much time on geometry and algebra, and they can't balance their checkbook. They can't read the label on a box of food. They don't know what they're eating. They don't understand sleep hygiene. They don't understand their own tool. Yeah. They don't understand how caffeine gives them attention deficit. They don't understand themselves, but they know algebra.
Yeah.
It's like algebra is not a success skill, and I don't think 80% of all the classes I took have led to my success. Etc. I want to go around the world with you again because you're so you've been around the world. Walk us through Egypt, Saudi Arabia, and Dubai. Is it like America, where when I was a freshman in dental school, the senior class had one woman? And America, really back then, most Americans would say dentistry is a male profession. Now, last year's dental graduating class of 2016, I believe, was 45% women. What's the male-female ratio in Egypt, Saudi Arabia, Dubai, UK? Is it changing?
I think, I don't have exact numbers. I can just tell you with what I've seen. And what I've seen is, it depends on the specialty. So, like you said, you wouldn't see a lot of, for example, female oral surgeons or oral maxillofacial surgeons. It will all be a male profession. You would see a lot of percentage pediatric female dentists, general dentists as well. a lot. General dentists, you'll probably see a lot of female, a lot of male as well. They're both way up there. The thing is, not a lot of dentists go into getting specialized. So you could be a general dentist who does implants, who treats children, who does very complex oral surgery, but you're not specialized. You've got all these skills, but you're still not specialized. And you just kind of got forgotten about, because you're not really, you're not getting out there. You're not saying, well, I've got this specialty. I'm 100% doing implants. I've done that for many years, but still I'm not specialized. So people are like, well, you're just a general dentist. You're not doing that. And it's getting much better, because universities, especially in Saudi Arabia and in Dubai as well, are sending their students to get specialized in number one universities in the world, so UK, USA. Some would send to New Zealand for some reason, and they get specialized and they come back and they usually get academic careers as well, and they're just working on getting that next generation in. And dentistry, what I've noticed is a lot of high school graduates are getting into dentistry much more than any other profession. And that's something interesting that I've noticed. So I remember when I was in high school, and when my sister, she's 7 years younger than me, all my friends and all her friends are dentists now, are getting into dental school.
Because you led them. They were all trying to be like you. I bet that was a big part of it.
No.
Well, was your dad a dentist or mom a dentist?
No, they weren't.
So I guarantee you were a role model.
But it is getting really popular in Egypt. Dentistry has become one of the has got the highest percentage of students, on a university level. So you would have students into engineering, into the arts, into this and that. The greatest percentage of students of that university they're all in dental school. So it's getting much more popular, with people getting to know them.
Sensitive question, but I want to ask. In a very conservative country like Saudi Arabia, do women and girls prefer to go to a girl dentist and boys prefer to go to a boy dentist?
They used to. So it used to be an issue in the past. So when I say in the past, I'm talking about 10 years ago. So not that far away. It's not becoming such an issue anymore. People are getting much more comfortable with any dentist, as long as he's a good dentist. They don't really care that it has to be a female. It's not like, for example, being a GYN or anything like that.
As what?
Or being in gynecology and
Oh, yeah.
like that. But I don't think that it's such an issue like before. I think
it's
people
still kind of an
more
issue in America. I went to a gynecologist and they refused to see me, and I thought that was kind of. I was hurt. I was offended, but and then back to because on this show, 81% are Americans, 19% are from 140 countries. So most of them will never be fortunate enough to see Egypt, Saudi Arabia, Dubai. Just tell us a little bit about what is it like being a dentist in Egypt versus Saudi Arabia versus Dubai versus the UK? Is it
in Dubai, it's all about aesthetics.
Yeah.
It's all about aesthetics. Veneers, bleaching, everywhere.
And it's funny because a lot of people who haven't been to the Middle East, like a lot of Europeans, will say that Americans, their teeth are too white. They look like they're a clown, and they bleach into white. And these companies like Ivoclar had to come out with, I mean, when I was little and got out of school, you just had B1. They had to come out with bleaching shades, even whiter and whiter and whiter. And the Europeans, especially in Germany and Liechtenstein, Austria, are saying, oh, those are clown shades for America. But it's not just America. The Middle East wants their teeth as Clorox white bleach crazy as Americans. They might be crazier than Americans when it comes to white teeth.
Yes. And
That's true, isn't it?
Yeah, it is. It's very true, and especially in Dubai. I know a lot of people who would go specially to Dubai to whiten their teeth. Especially, they're just going there to do that. In Egypt, it's more about in Egypt. It's more about the treatment itself. It's not so much about bleaching. It really depends on the money that people have and the economy, and people just can't afford having bright white teeth. They just want to get that tooth that's really hurting them taken out. They don't even want the filling because it's going to cost more. So you'll just I don't have to come to you 3-4 times. Just take that damn tooth out and let me get out of there. And that's the problem with Egypt. It's the economy, I'm sad to say, but it really is a problem, and it's affecting dentists as much as patients as well. Saudi Arabia.
So repeat that. So the economy in Egypt is affecting the dental industry.
Yes.
So who is Nigeria the most populous country in Africa, and then Egypt number 2? Or?
Yes, I think Egypt we're 85 million.
And Nigeria's.
I'm not.
I think
sure
90.
Yeah.
I think what is there? 56 countries in Africa.
Yeah.
And Egypt's just a huge country.
It is.
I mean, what'd you say? 85 million.
Yes. And some people in rural areas and farms and all that, they've never even seen a toothbrush before. They don't even know.
So it still has a
means.
large underdeveloped poor population.
Yes.
How's the economy in Egypt going these days?
It's much better than before. I mean, there is always ups and downs, and media always blows things out of proportion. But I think that it's going much smoother than before. I think that after the revolution and the change of presidents and all that, they feel that they've got much more choice in getting a say on what they want for their future and what they don't. There's always the occasional "I hate the government" guy, but I think it's getting a little bit better.
Yeah, it's really sad, and that's why I say if you really want to get smarter, quicker, faster, get out of your country, get out of your tribe, because what you'll do is you'll find out when you go to another country, everything the media and the government told you about the other guy is never even close. Yeah. They're not even in the ballpark. And you go there and you see the exact same human with the exact same needs of needing shelter, needing a dentist, needing breakfast, needing lunch, needing to raise their baby. And I love going to other great civilizations and just seeing how the same person dealt with the same problem, but just slightly different.
Yeah. And
those slightly different nuances, I don't care if it's an architecture, I don't care if it's something as simple as a toilet. I find it fascinating, a toilet, a window, a dentistry, a dental chair, an operator. I just find the nuances, that's where the wisdom comes from, seeing the nuances. And then you go back through history, who were some of the smartest people? It was like Marco Polo, because he left and went all the way to Hong Kong and back, or St. Peter the Great, because he sat there and said, you know what, let's leave Moscow, let's take all of our money and let's just go around Europe, and he came back with 20,000 artisans and artists, and that's massively stimulated Russia.
And I think an interesting fact as well is that there is evidence to support that the first implant ever done in the world was done by pharaohs in Egypt. Yes. And it was mummies that they found this mummy was with an implant and a tooth and a gold wire and all that. So it's something that I found to be really interesting. It's like, it goes back all that way back, and you've got that history. And
you want to hear the wildest statistic about Egypt?
Well,
from the time of Cleopatra to the first dental school in the world, University of Baltimore, is a shorter time period than from Cleopatra to when they built the pyramids. Isn't that amazing? The first pyramid to Cleopatra is a longer time period than from Cleopatra to the University of Baltimore Dental School.
Wow.
That's how old Egypt is.
Yeah.
So what is older? Is who's has the oldest civilization? Would it be the Chinese or the Egyptians? Who's older, the pharaohs or the Chinese?
I'm not sure. I think it might be the Faroes. I'm not entirely sure. It might be the
I
Greeks.
yeah. Well, I notice when you go around the world, countries like if you go to Germany, they say they invented what you call perfume in Cologne. You go to Paris, they say no, perfume was invented in Paris.
Yeah.
In the United States, I'm not making this up. You can go. I've been to 6 different states who had a museum where ice cream was invented. I'm like, okay, well, a quick Google search shows you might not be the place that invented ice cream. But I am proud to say that a dentist did invent cotton candy.
Yeah.
He was trying to build up business for everyone. I'm going to improve cotton candy. I'm going to genetically splice cotton with sugar cane so you can grow cotton candy. That's my only mission in life right now. So of all these great civilizations you've been to, why Dubai? Is it because of the Tom Cruise movie you saw?
Yeah, it is because
you saw Tom Cruise swinging around on that building?
With Burj Al Arab Tower.
Have you been there?
Yeah, I have many times.
And how tall is the building, or how many stories tall, and how high did you go?
I think I got to. You can't get to the very top floor.
Tom Cruise did.
Yeah, well, yeah.
You're saying you're not Tom Cruise? Is that
I'm
what
not.
you're telling me?
But you can get to, I think, the 85th floor or something like
85th
that.
floor.
Yeah, but more than there are businesses up there as well. So there are companies there. There are offices, and I think I actually in the lift I got to meet one of the people who work there. And I'm like, how does it feel to have an office on the 82nd floor? I mean, do you feel on top of the world? And he's like, oh well, it was all right. It's okay. And yeah,
I just want to know how Tom Cruise was let into the country. Why would they let the craziest American alive into Dubai? I still
got
can't.
nice teeth, Tom Cruise.
His midline is off almost an entire tooth. It's an amazing, deal. Where that's an amazing deal.
But Dubai is a very, like I said, it's a very multicultural country. There is lots of opportunities there to build a practice, to get to see people from different backgrounds.
Now, people listening around the world, if you were a dentist in Australia, New Zealand, America, how hard would it be to get a license in Dubai if they wanted to move to Dubai?
Well, it depends. If you're a general dentist, you would just have to take an exam. If you pass that one, that's fine. You're just gonna get your license. And
Written
that's
exam
it.
or on patients?
Written exam.
So if I went there and passed a written exam, I'd get a license?
Yeah.
Can I take it online, or do I have to go there and
No,
take
you
it?
have to go there.
Hi, when I lecture in Dubai next, I want to take the exam. I just want to see what the exam would be like.
But if you want to be a specialist dentist or an academic career or anything like that, then you have to take another second exam, and you have to wait about 4 or 5 years being specialized until you get licensed as specialist license.
So if you treated 100 babies, how many of those would you do with behavior management versus nitrous oxide gas inhalation versus I need to take you to a hospital and use sedation?
Well, I never ever see a child who's anxious, and for the first second I think, well, I don't think this is gonna work. I think I'm just gonna put him to a general setting and refer him. I always try, even if a lot of dentists tried before me and they referred him specially to me so I can refer him to a hospital. I would still try first. I would still do a lot of the techniques. I've just even if I've just put 1 hour, 2 hours, especially to that child, just to try and do my best. I don't want to refer him to a general setting or a sedation and then something happens, and then it will be like, well, my child is now in a critical condition, or even worse, passed away, and it's all because he had a toothache. I don't want to have that kind of guilt, or I don't have that heading over my shoulder all my life. I will be, we've tried everything, and it was a conscious choice that was made that this was, the only other solution. We've tried everything else, so I always like to try first. A lot of the patients who've been referred to me for inhalation sedation, for nitrous oxide, on the day, I would completely change my mind. I'm like, you know what? You don't need to be to have the gas and air anymore. I don't think you do. And the parents were like, but we got referred to you, so he would have the gas and air. I'm like, I don't think your child needs it. I think with just a simple chat, he'll just get over it and we'll be fine. And they do. And I completely changed the plan on the day. And I'm like, you know what? I don't think you need it at all. Other children would come. And, I try everything, it doesn't work. And then the next step would be trying inhalation sedation, nitrous oxide. And if that doesn't work, then we'll say, well, you know what, we've tried everything. Let's just put them to sleep and get on with it. Because, we have, especially if they're in so much pain, that will be a problem.
So on Dental Town, we have 50 categories, root canals, fillings, crowns. One of them is pediatric dentistry. And it is just sad. Dentists get very mad if I say anything negative against dentistry. But I believe that if you don't clean up your own profession, then you're going to force the hand of another party, whether it be lawyers, the government is going to come in. And America, you can't go 1 month without seeing on the news. I'm just reposting things that are from the newspaper in Hawaii, Dallas, Florida, of somebody killing a kid with sedation in an office.
Yeah.
The UK in 1998 started looking at the sedation of dentists and said, no, you're not going to do that. You're going to do that in a hospital. And America has a huge problem. And when they see this anxiety, they skip the brain and just go. They want to work on that too, so they knock out the brain. And I think Texas has had seven deaths this year.
Oh, God.
And there couldn't be a bigger tragedy in life. I got my 4-year-old granddaughter. I couldn't think of anything more devastating than she went in to the dentist and died. And so this is just a huge problem.
Yes.
I wish you would post your thoughts on their pediatric dentistry on Dental Town.
I would be happy to.
There's 217,000 dentists on there. 50,000 have downloaded the app onto their phone, and the community grows at 1,000 dentists a month. Actually, between 1,000 and 1,800 a month from around the world. And I really think the number one issue for any civilization of any generation is what's best for the babies in the next generation, not what's best for grandpa. And most people don't believe this, but we have 400 courses online on Dental Town. Ryan, do you know the number one watched, viewed course? Who is it? Pediatric Dentistry. So, and I think some of that is economics too. So I was born in the baby boom generation. So about 1945, the American women started averaging like 5 kids per family, and there's this big baby boom glut. Well, now they were the generation that went from silver fillings to tooth-colored fillings, bleaching. So they were the cosmetic generation. Now they're retiring at 10,000 per day. So now you're seeing implants explode, because now all the old people, like as old as Mike Gow, are starting to need dentures and partials and implants and all that stuff. But what people aren't talking about is the baby boomers had the Generation X. The Generation X had the millennials. And in 2007, the millennials in 1 year had 4,700,000 children. So they're calling this now an echo boom. So pediatric dentistry is exploding. And then I can show you the data on Dental Town where the courses on pediatric dentistry are the most popular, because these dentists are, all these children are coming in and need all these procedures. And we weren't really that well trained in that.
I think it's also a problem that I've seen extensively in Egypt. I would literally go speak to any, into any university, and the first thing, well, if he really doesn't sit in the chair and he wouldn't really open his mouth, just refer him to general aesthetic. What are you doing? You're just wasting your time. You could have been seeing lots of other patients, getting profit from all these other. Are we really wasting a whole hour on a brat? And I'm like, well, you know, you're not solving the problem. Well, you're really not. I mean, if he just goes and he wakes up and, you know, all his teeth are taken out, what kind of message are you sending exactly? You're just increasing the anxiety. He's not going to adjust his dental habits because, you know, you haven't spent the time to talk about that. And it's just getting worse and worse. And so what exactly are you doing? And I think it really all goes back to the education. If the dentist is confident enough and he's got the skills, and, you know, just the same way as they teach them to do a filling, like, you know, drill, fill, and do all that.
Bill.
And just, and bill.
Drill, fill, bill.
Yeah. You have to teach them how to also have techniques of it. It's not all about the treatment. The treatment has got so many divisions to it. There is the psychological part. There is, you know, the actual drill and fill part, and, you know, and it just goes over their heads that they, you know, it's something that really needs to be taught in dental schools. It's a really important subject. It's something that will modify the future of dentistry, and, you know, how patients or how people in general will handle their dental health, their dental hygiene. It's something that really, really matters. It's not just pediatric dentistry. I think it's in all these other specialties as well. If you go to this really, so for example, if you're going to do this very complicated procedure, like getting a wisdom tooth out, okay, a lower 8 or an upper 8, and it's an impacted tooth, and it's an, you know, an oral surgery kind of thing, and you go to this oral surgeon, and he's the best in his field, but he's a rude guy. So he's very cocky. He's very full of himself, and
so you're talking about every oral surgeon?
Yeah.
Okay.
No. but
except for Jay Resnick.
It's fine, yeah. But and you think, well, you know what? I don't really like you very much, and even if you're the best in your field, I don't think I'll let you, you know, handle my teeth at all. But if he's got the slightest skill of, you know, behavior management, understanding what the patient needs, you know, just sitting there and talking to him, he'll be, you know what, I'm so lucky, you're a great person, you're a great dentist, you're the best in your I would be happy, you know, you can do whatever you want with my teeth, whatever you find right. So I think it's all dentists. I've got a little story for you. My dad, he's been going to a dentist for, I think, for 15 years, and I've known that dentist now with all due respect. He's not a very good dentist. So everything that he's ever done for my dad has failed. He's done crowns for my dad, who's fell 2 weeks later. He's done fillings, who's all has got recurring caries now, you know, about a year later, which is not a good percentage. So everything he's ever done for my dad has failed. And I looked at him and I'm like, why do you keep going back? He's not a good dentist. I mean, I know I'm in the field. I can refer you to really good dentists. If you don't want me as your daughter to do anything, that's fine. But I can refer you to really good, smart people. And he's like, but I like him. I trust him. And, you know, even if he messes up, that's all right. I mean, no one is perfect. And it just amazed me. I mean, it's not, you're not even upset about, you know, going there over and over and getting your teeth done over and over. You're just happy that he's a decent guy. He knows how to handle your anxiety. He knows how, you know, he's got that skill. So, and it just amazed me. And I'm like, well, you know, it really is about, you know, that
that's all
skill.
it is.
Yeah, so.
Like in the United States, there's 1 million physicians, and half of them, after school, after practicing 5 years, passed an all-day exam and became board certified. Mm. The other half went their whole life and thought, I don't even care, I'm never going to do that. Mm. I've never met an American who just said, oh yeah, you should go to my doctor. And I was just like, well, is he board certified? Mm. I've never heard anyone even know or care. They refer you to their physician because she's a nice lady. She's a nice guy. I really like her a lot. Mm. And that's all that matters. Yeah. Yeah. Amazing. What was the I want to ask you, our hour's up. That was the fastest hour in the world, but I want to keep you for an overtime question.
Thank you.
Another extremely controversial question in the United States is, Do pediatric dentists should they do phase one orthodontics or not? Should they send them to an orthodontist? When you see a 6-year-old with a crossbite or they're sucking their thumb, do you treat that or do you send that to an orthodontist? What are your thoughts on thumb sucking, crossbites, phase one ortho when they're under your care?
Again, in my personal opinion, I think that it will be extremely beneficial for pediatric dentists to go ahead and do a phase one orthodontic course. They don't have to necessarily do any orthodontic treatment themselves, but I think that it's a really good thing to have a background because, well, not all orthodontists are great orthodontists, with all due respect. So it's nice, especially if you're working as a team in a clinic. You have to be on that same wave. So if the orthodontist would come and say, well, I think that I'm going to do this and this and that, and you have no idea what he's talking about, and I have no idea how that will impact your treatment plan, and then it's just not going to work. It's just going to be chaos everywhere. But if you've got like a little background, well, yeah, I think maybe that's the right choice, and we can discuss it and see, what's going to be the best option for, you, me, and the patient. It will be much easier. It's kind of like, being in prosthodontics, for example, or doing a denture, and you don't really have to go through all the technicalities of a technician of how he's going to do the denture and how he's going. But you have to have a background of how it's done, so that when when he sends the denture over, and there's something wrong with it, if you have no background at all of how it's done, you won't really, it just doesn't fit. You don't know why. You don't know where the problem is, but if you know how the process went, you know what, I think you've done this and that in the procedure, and I think the next time you do it, just avoid doing that or just change the way you do that, and then it's going to be much better communication, and it's just not going to be a pain for the patient himself. Going to all these dentists and no one has no idea what's going on. It's just, what, we're just going to try, do a first impression and just try the whole thing again. Maybe it will work that time. Do you know what I mean? So I really think that mutual cooperation and understanding and communication between the dental team and especially pediatric and orthodontists is very, very crucial. I've got lots of friends who have specialized in both. A double major, and I really think that was amazing that they're on top of it and they really know anything that relates to a child. They know how to handle it, and it's amazing. But I think I would advise of taking a phase one orthodontic course.
I would love to get a pediatric phase one ortho course on Dental Town. Because a lot of times there's just a sweet spot when it's so easy to intervene, where if it doesn't get treated and they get all full grown and a girl's 12, boy's 14, a lot of times you've missed a lot of opportunities. Exactly. One last thing, you're so educated in the mental health along with the dental health. So many dentists are always wondering when the child's coming in sucking his thumb. I had 4 children. One of them loved that, and it was actually great because I always wished I could suck my thumb. And I wish when I got stressed out, I could just go in the corner. I have to go eat a whole cheese pie or a pizza so the child, it gives them mental health. They love it. They start doing it and they're all relaxed and they're happy. When does a child have to stop sucking their thumb, and how do you get them to stop sucking their thumb?
As soon as possible. It's a habit that has to be...
Oh, now you're just being mean.
No. No, but really, the longer that you do it, the harder it is to stop. So as soon as you see your child doing that habit, starting that habit, just try and break it off right away. I think, just don't just,
So do you think it's easier to stop, like when you bring them home from the hospital and they're doing it, just keep taking their thumb out of their mouth?
Well, there's lots of options that you can do. You can make them wear gloves. Mm-hmm. There's special oils and polishes that you can put. It just tastes nasty, so they just, they hate doing that. There's also the appliances, which I think is something that we would resort to as a very last solution. But I
You
think
still like just putting a sock over the hand when they go to bed?
sometimes we do. We advise parents to do that as well. I think that we should try every other option out there before resorting to an actual orthodontic appliance. I think that should be the very last thing that we should do.
Have you seen those YouTube videos going around the internet of ultrasounds with the baby sucking the thumb in the womb?
Yes.
That is just, when I saw that, I thought, wow, that is so amazing to see a baby had not even developed and it's already got its thumb in its mouth. I got to tease you. My oldest sister, Mary Kay, is a Catholic nun, Sister Anne of Yahweh, and she wears the exact same thing you do.
Oh, really?
So I feel like I'm sitting here talking to my oldest sister, Mary Kay's sister Anne of Yahweh, who I always see her just like you. I've never even, not since I was 17 have I seen her with this off.
Really?
Yeah, I've never seen her with it off once since I was in high school.
I do take it off though.
You do take it off?
Yes.
But not in public though.
No, not in public.
Yeah, so I've never seen my sister without hers off since 17 to age 53.
Wow.
But I think we should name this podcast a tooth fairy riding a unicorn, because I think you're the most special person.
Thank you.
Your experience is so broad. You're so smart. You're so knowledgeable. I hope you post your amazing stuff on the Pediatric Dentistry forums on Dental Town.
I'd be happy to.
217,000 other dentists could read your stuff. But thank you so much for being on my show.
You're welcome.
Thank you very much.